you know, do you talk about ovaries, you know, in public kind of thing, you know?
Oh, okay.
For ovarian cancer, the problem is that the symptoms of ovarian cancer are the same as symptoms of a lot of other things that we see that are much less serious. So what occurs is that women will go to their doctor with some of these symptoms, and the majority of the time their doctor initially tells them it probably is associated with something much less serious.
It actually took a year from the start of my symptoms to the day I was diagnosed to discover my cancer.
Abnormal bleeding, stomach cramps, bloating, weight gain, weight loss, anything that can be confused with everyday symptoms.
The mass was bigger than a basketball that they found inside my stomach, on my ovaries. I'm fighting. And I've been fighting since I found out about it, since 2009.
When we catch ovarian cancer early, it's usually because we're lucky or because someone has a lot of pain related to a big mass that's confined to an ovary that prompts evaluation. If something doesn't feel right, ask why.
I dismissed a lot of things, blowing it off, thinking I was either coming down with the flu or just gaining weight, when in retrospect what I know now was actually signs of ovarian cancer. You've got to listen to your body, and my body was screaming, it wasn't whispering, and I kept dismissing things.
So every woman should try as hard as she can. Find out if anyone in her family has had not only ovarian cancer, but breast cancer also. Both those things really increase a woman's risk of developing ovarian cancer, and she may be appropriate to be screened for a genetic predisposition. And that is the most powerful thing that we have to identify those women who should undergo risk reduction surgery, for instance, or even take prophylactic medicines such as birth control to lower risk.
Patients that have been on the birth control pill for approximately 2 years can decrease their risk of developing ovarian cancer by up to 50% in the future.
Women who have the breast cancer gene, BRCA1 or BRCA2, are not only at risk for breast cancer, but it increases their lifetime risk to between 20 and 35% of developing ovarian cancer. So these women really do need counseling. They may have choices that they can make to reduce that risk significantly. And seeing a specialist like a GYN oncologist to have that conversation is very important.
Every woman needs to know that it doesn't affect just old women. It affects young women. 34 when I was diagnosed, no idea, just going through life, trying to live it and do things, and all of a sudden it hits you. And
what kind of cancer?
Ovarian, stage 3C. And yeah, it affects more women than you know, and I think more women need to talk about it. The best thing is to see a GYN oncologist and get them to do your surgery and do your treatment, because they're the best.
What I urge women to know, younger women, all women, is basically to trust your body, listen to your body, and when something feels like it's different or not right, then don't be ashamed or afraid to go and find out what's going on and ask somebody to evaluate you. Okay. Don't assume that something is normal that is a change from your baseline.
I think that women should know they should be proactive about their health, have their checkups with their breast, pelvic, and pap exams, and if they have any unusual symptoms, they should ask their doctors for an ultrasound. And if they have a family history, they should ask for genetic testing.
Es uno que debe de pedir. Es uno lo que uno debe de controlarse, de decir, doctor, ¿qué es lo que me está pasando? Doctor, quisiera saber cómo están mis ovarios. Por favor, hágame una orden de un sonograma, una colonoscopía más extensa o un casting. Hay que darse el tiempo para ir al médico.